Okay, so now let's talk about the veins that pass through the superior aperture. So remember when we talked about some structures exit the superior aperture from the thorax into the neck or the arms, and other structures enter into the superior aperture into the thorax from the neck and the arms. Well, remember, veins always travel towards the heart. So these veins, the subclavian vein and the internal jugular vein, so this is both on the left and the right side, they both come together to form their respective side brachiocephalic trunk. So on the right side here we can see that we have the right IJV, and here we have the right subclavian. So same thing on the left side, and these two, they join to form the right brachiocephalic trunk. So it's the same thing on the left side. So this is the left IJV, and this is the left subclavian, and this is the left brachiocephalic trunk. So both the right and the left brachiocephalic trunks meet to form the superior vena cava at the level of the first intercostal space, just on the right side of the midline, anterior to the trachea and esophagus. So here we can see right over here as it goes. So this is right behind the thymus and in front of the trachea and esophagus. This is now the superior vena cava. So these are the tributaries draining into the superior vena cava. Okay? So let's talk about other veins at the level of the superior thoracic aperture. So one, we have the internal thoracic vein. This runs parallel to the internal thoracic artery. We can see this one right over here. This is the left internal thoracic vein. And it's running parallel to the internal thoracic artery. So the internal thoracic vein drains into the brachiocephalic vein of the respective side at the level of the superior thoracic aperture, just below the first rib. Next, we have the pericardiacophrenic vein. This drains venous blood from the fibrous and parietal layer of serous pericardia and the diaphragm into the internal thoracic vein at the level of the superior thoracic aperture. Sometimes it drains directly into the brachiocephalic trunk. So in the diagram we have here, we can see, let me zoom in for you. So you can see over here, this tiny little vein over here, this is the pericardiacophrenic vein. So let's write this over here. And this accompanies the pericardiacophrenic artery and the phrenic nerve into the thorax along the right and left sides of the mediastinum. After that, we have the external jugular vein. This drains into the subclavian vein just posterior to the clavicle and just above the first rib before the subclavian vein enters the superior thoracic aperture. So this is the external jugular vein right over here. Now the external jugular vein also gives a branch called the anterior jugular vein. The anterior jugular vein drains into the external jugular vein before it meets the subclavian vein at the level of the clavicle. So here we can see the anterior jugular vein draining right into the external jugular vein. And we also have the inferior thyroid veins. These are the inferior thyroid veins. So the inferior thyroid veins, veins, drain the venous blood from the thyroid gland and drain straight into the brachiocephalic trunk of the same side, just below the plane of the superior thoracic aperture. Usually, though, we only have one tributary of the inferior thyroid veins because veins from both sides join to form a bigger vein which drains into the brachiocephalic trunk of the left side, the left brachiocephalic trunk. And then we have the thymic veins. The thymic veins you can't really see in this image because the thymic veins would project forwards between the left brachiocephalic trunk and the thymus gland right over here. So these thymic veins, they also drain venous blood from the thymus gland into the left brachiocephalic vein, and this is also at the level of the superior thoracic aperture. And the last vein that is one of the most important veins that we are discussing at the level of the superior thoracic aperture is the vertebral vein. The vertebral vein, let's show you a different diagram. Here, you can see it in this one. So the vertebral vein, this over here is the vertebral vein. And this vertebral vein joins the cervical venous plexus, which descends through, the cervical venous plexus descends through and around the transverse processes of the cervical vertebrae, accompanies the vertebral artery, and merges into the vertebral vein at the level of C7. It ends by draining into the brachiocephalic vein of the respective side at the level of the superior thoracic aperture. So here you have it. So this is the vertebral vein. And this is the cervical venous plexus. This here is the IJV. This is the external jugular. And this over here is the anterior jugular. And of course, all of these are the right side.